Natalia, and this is
Asher.
And today we're going to be talking about the controversial topic, assisted suicide, and whether or not it should be legalized in all states.
So at the moment, the 10 states that it is legalized in are Washington, Oregon, Montana, Vermont, New Mexico, California, Colorado, Hawaii, Massachusetts, New Jersey, and the District of Columbia. It is all legalized in.
So how much does this cost? It costs $3,500.
Yeah, $3,500.
$3,500. With the okay.
Okay. So with the law that is the assisted suicide, or it is also known as aid in dying. So if you hear a switch between that, that's what that is. But assisted suicide or aid in dying has a law in Oregon called the Death with Dignity Act, and it is also in Washington too. The cost about it. People are curious how much it pays. One, insurance doesn't pay for it. It has to be out of pocket. But with the law, it can cost up to $3,500, if not more, depending on the state you are in and if your state has the Death with Dignity Act or not.
So some information about the Death with Dignity Act. The requirements that you would need to be eligible for assisted suicide: you would have to be an adult, 18 years of age or older, a resident of Oregon. This is just for Oregon, not all. These rules may differ between each state. So resident of Oregon, capable, defined as able to make and communicate healthcare decisions, diagnosed with a terminal illness that will lead to death within 6 months. That's very important. You can only be expected to live up till 6 months, or else you're not eligible.
Yeah, for real quick, some things that some people might get confused, because you can get assisted suicide depending on a mental illness, but we are not covering that. This is with terminal illnesses, and you have less than 6 months to live.
The patient must make 2 oral requests to his or her physician separated by at least 15 days. A change to the law effective January 1st, 2020 allows patients whose life expectancy is less than 15 days to skip the whole waiting period. So it just depends on your specific, medical case. The patient must provide a witness request to his or her physician signed in the presence of 2 witnesses. The prescribing physician and a consulting physician must confirm the diagnosis and prognosis. The prescribing physician and consulting physician must determine whether the patient is capable, and if either physician believes the patient's judgment is impaired by a psychiatric or psychological disorder, the patient must be referred for a psychological examination. So it's really important that the patient is of sound mind and body, that they're able to make this decision. And this is from Oregon.gov, and that's...
From what I found on Medical News Today, so different than her stating the laws, Medical News Today said 1984 is when the Death with Dignity Act passed in Oregon. Washington, I can't find a year yet, but I will let you know on that. I also found on Medical News Today was 0.3% to 4.6% of deaths in the country of assisted suicide. 70% of them were tied to cancer and terminal illnesses that led to 6 months. That made sense, obviously. But most of it was tied to cancer.
So a reason that people are going back and forth with this argument is because the assisted suicide it's not that it's cheap, but it doesn't cost as much as a cancer treatment would cost. So instead of people leaving their family with a bunch of debt to pay after they're gone, people opt for the assisted suicide, which is way less, and they can afford themselves. So that's also a big thing. So if we were to start legalizing assisted suicide everywhere, people think that the treatments for what they have should be cheaper or made more
profitable?
No.
Not profitable.
Everyone
gets it. Also found that assisted suicide, it was more commonly known with Caucasian white people, and people have really good insurance, which that honestly surprises me, to be honest.
Yeah.
Yeah. Day 2.
Okay, so yesterday we left off with telling you about what kind of people are eligible or more likely to get assisted suicide done. We realized we didn't point out the differences between euthanasia and assisted suicide.
Real quick, sorry. When our first project preview, or just sharing out our topics and what we're planning on doing, a lot of people had it confused. So we are not confused. Thought they were similar, or at least like, well, what was the difference? So like, we just want to point that out.
So assisted suicide is where you are prescribed a pill or drug from your doctor and you take it yourself, whereas in euthanasia is where you are injected by the provider.
So one of the things I found, I think it was in Medical News Today, or is a different website that I cannot think of at the moment. I will find it and cite it later. But it was saying on how voluntary, or like, it was mainly talking about euthanasia, but it was saying that voluntary would be like the person is still in their sound mind and everything, and then just like for whatever was happening to them, it was just like, I want you to inject me with the drug and everything, don't want to be through pain or whatever. And then I think it was called non-voluntary or involuntary. I think was it non or in for the one that, because the way it described it for non or involuntary, I think it was non-voluntary. The way they described it was that they were in a coma, and so it was like the spouse family member or someone, they decided to like be like, oh, well, I don't want them to suffer anymore, so it would be what we call it as like pulling the plug. So in Psychology Today, that was my first source evaluation, and I didn't really find that one like biased or anything. Okay, maybe a little bit, but it wasn't like against or for it, but it was like, if you know someone who's going through this, on like how to support them, so it might be a little biased, maybe a little bit. But it gave a whole bunch of facts. Okay, Medical News Today says in most countries, euthanasia is against the law and can carry a really long jail sentence, because most countries also would count it as murder. But there are 9 countries besides the United States that have it legalized of you can do euthanasia and assisted suicide, so love that. Only for terminally ill patients. I'd like to point that out. We're going to be talking about our opinions because we got a lot of feedback that we should add in our opinions with at least this subject, so yeah. My opinion, at least, is that I think it should be legalized in all states, and I wouldn't say like a lot of, like most of the countries, or like the whole world, it should be legalized, but I do think that it should be more legalized around the world than what it is at the moment. I also think because of it, I don't know. I mean, it may not seem like it cost a bunch. It's only $3,500. But if you are, most of it is seen with like a whole bunch of cancer patients, but that costs money. All of the medical bills cost money. So, and it has to be $3,500 out of pocket. It can't be like your insurance covers it. And I think that's a little stupid, just a little bit. That I think insurance should be, yeah, I got you, boo, type. I probably shouldn't have said that, but what else did I put? Family. Family is what we needed to talk about. Is I don't think family should have a say in it. In Psychology Today, it was saying on how you can support them, and it was just don't necessarily put in your opinion. Like, a lot of people who choose assisted suicide they don't want to seem like a burden, or all of like your family's going to be left with like a lot of medical bills and don't want that to happen. And so I don't think that family should have a matter, because then it's going to be, well, I'm going to love you and I'm going to miss you type, but it's like, there's so many things that go into it, but I don't think that your family should have a complete say in it. It should just like, they can give you their opinion on it, but they shouldn't be the ones deciding it for you, you know?
The article Disability Rights Education and Defense Fund, DREDF, I've cited that they say They say the incentive to save money by denying treatment already possesses a significant danger. This danger is far greater where assisted suicide is legal, so direct coercion is not necessary if patients are denied necessary life-sustaining health treatments, or even if the treatment they need is delayed, many will in fact be steered toward assisted suicide.
No, you're good, don't worry.
So, with all that saying, basically that in order for assisted suicide to be legalized everywhere, the price of treatment for these terminally ill patients would need to be lowered for it to be, I guess, more ethical, and so that people don't feel coerced to choose the assisted suicide options.
Well, does that conclude everything?
I think that wraps it up.
Yeah, okay. Thanks for watching the